Well, hey everybody. I'm just going to give participants a few minutes to log in, and then we'll get started. Maybe just one more minute. Just want to make sure everybody can see my presentation. Maybe someone can send something in the chat that says, "Hey, I can see it," or uh-oh, it's not looking so good. All right. All right. Good. I'm glad. Always good to double check, I guess, isn't it? All right, why don't we get started? I guess what I'm going to do is talk for a little bit about this area of research called decision-making, crowdthink, and COVID-19. And then at the end of my presentation, I'm going to give you the opportunity to log in to a Google form and submit your own question or your own answers to 3 questions. And then we're going to analyze them on, using Python and see what you think. And I think it'll illustrate kind of 3 central points to why I'm doing this type of research. And we'll have time at the end too for questions. You can ask questions in the chat. I have the chat up just in case. I'll see it as I go through my presentation. And I think that's it. All right, well, I'm Tom McAndrew, assistant professor in the College of Health at Lehigh University. I have a research lab here called the Computational Uncertainty Lab. And today I'm going to talk about decision-making, crowdthink, and this thing called COVID-19. In late December 2019, SARS-CoV-2 was first reported in Wuhan, China. The US announced their first death due to COVID-19 on February 27th. I started these surveys asking experts for predictions about COVID-19 February 17th. That was the first survey. March 12th, the WHO announced COVID-19 as a pandemic. The IHME model presents their first forecast from computational statistical models on March 25th. April, the Forecast Hub, which is a collection or ensemble of computational models, comes online in early April. And this is a little outdated, so there's certainly more deaths than there was at the time I made this presentation. But the point of this slide is to say that my first expert survey was early. I didn't have to train a computational model on a time series of COVID-19. I could send this and submit this survey early. What did I ask on February 17th, which feels like forever ago? Well, here's 3 questions of the 7. Do you think that the confirmed case count of COVID-19 in the US reported by the WHO on April 1st will exceed 100? To give you this perspective on what we were asking and what it looked like in February 17th. As reported by the WHO this coming Sunday, which at the time was February 23rd, will the number of cumulative confirmed cases in the US with possible or confirmed transmission outside of China exceed 5? Okay, this was just starting. Another question I asked is, what's the smallest, most likely, and largest number of all cumulative confirmed cases, including cases of local transmission in the US, the WHO will report this coming Sunday. Here's an example of 3 questions I asked on February 17th. Here are the answers. The first question's on the far left, the second question's in the middle, and the third question's on the far right. On the horizontal axis is the probability that experts assigned to there being more than 100 cases by April. In the middle one, it's the probability experts assigned to more than 5 cases outside of China by February 23rd. And then in the last one here, it's experts on the horizontal, and on the vertical is their smallest, most likely, and largest predicted confirmed cases. 9 out of 15 experts assigned more than 50% probability to there being more than 100 cases by April. That means that 6 did not. 8 out of 50 assigned a probability more than 50% of there being more than 5 cases outside of China by February 23rd. And on February 23rd, there was 35 cases confirmed by the WHO. So why am I doing this? This is an example of what was going on, what I'm doing, but why do this? Well, the goal of forecasting, at least for me, is to provide public health officials actionable information they can use to make decisions. Those decisions might be something like a public health campaign, the example on the far left here, which is fight the flu. They also use this to kind of balance vaccine stockpiles, need and demand, and also to assess hospital burden. These are just 3 examples of why I'm making these forecasts. I'm not making them for fun, making them try and inform decisions and change policy and behavior. Who are these? So I asked experts, I told you. Who are the experts? What do they look like? What does an expert look like to me? Well, we define an expert as a researcher who spent a substantial amount of time in their professional career doing one of three things, or all three: designing, building, and interpreting models to explain and understand infectious disease dynamics or the associated policy implications of them in human populations. The way I collected these experts was either by email. I'm very fortunate to have a great research community in infectious disease modeling, and so I know a lot of these people. So sent out a massive email to them. There were Slack channels dedicated to coronavirus and specifically coronavirus forecasting. So we posted a solicitation there. And at the end of this study, we had 41 different experts who participated at least once. So this is what an expert crowd looks like. It's someone who has spent a lot of time in their professional career doing this type of work, forecasting and prediction. When I sent them, so if you're an expert and you sign up, here's the type of email you would get. I would say, "Dear Dr. XYZ." First, I'd thank them for participating before, which I think is something nice to do. I'd also give them a report of last week's survey. What happened? What were the results? What did you say? What did your friends say? What happened? I would tell them that everything's anonymous. I would remind them that all the answers they give are anonymous, which is true. I tell them the due date for the next time that they need to submit their answers to a survey. They'd get a link to the survey, and then they'd also have the option to opt out if they do so choose. And then I also give them feedback, kind of detailed feedback on their forecasting results. I would tell them, what did the consensus of all experts say in each question? What was their answer? And what was the truth if it was available? This email does two things. It's a personalized email that was in their email inbox, which creates a social contract and a default. They don't have to go to a platform and log in and click something and make predictions. This is already, it was preloaded, sent Monday in their inbox. Also giving them feedback on their forecasting results has been shown in literature to improve accuracy. If you tell someone how they're doing, they might be able to adjust. Okay, this is kind of the logistics of the survey and what an email you would get if you were an expert looks like. What about when you click on that link? What are the types of questions? How are they formulated? And this kind of brings up the anatomy of a question that I would ask. So this question here asks the number of positive cases in the US that a specific surveillance forecasting platform, the COVID tracker, will have in their daily report Sunday, May 17th. For this question, your experts were allowed to use either their desktop, which is shown on the left, or a mobile device shown on the right. And there's three parts, I guess, to a question. One is some background information. So I gave them, in this case, a plot of the number of positive COVID-19 cases in the US over time. And I would tell them, as shown in the table and figure above, this is how many cases were reported. Then there was the ask. That's the second part of the question. So the ask in this case was the number of positive cases in the US. And then I would ask them how I want them to answer it. So in this third paragraph here, we provided a set of intervals where the true number of positive cases could fall. Assign a probability to each of those bins corresponding to your belief of how many cases will be reported next Sunday. The bins better sum up to 1 because it's probabilistic distribution. So here's an example of what, if you were an expert and you clicked on that link to take a survey, what are the questions you would get? Let's talk about the good stuff. Some of the predictions that experts made in this study. We're going to talk about 3 different areas: deaths, total infections, and confirmed cases. Let's first talk about deaths. So the question that was asked or posed was, over the last 9 seasons, the CDC estimates that the seasonal death toll from influenza outbreaks has ranged from between 11,000 and 95,000. This is that background information I was talking about. Here's the ask. What are the smallest, most likely, and largest number of deaths that will occur due to COVID-19 by the end of 2020? And the third part is how I wanted them to answer. And there was 2 ways that they could answer throughout the survey. One was called a triplet. So we asked them for the smallest, most likely, and largest number of deaths they believe will occur by the end of 2020. Or a percentile. So in this case, we asked for specific percentiles, the 5th, 50th, and 95th percentile. What did experts say? Well, on the horizontal axis here, I have the date the survey was issued to experts. We issued it 5 different times, this same question. On the vertical is the predicted number of deaths by 2020. In the blue bars are the 5th and 95th percentile. The black dots are the median or 50th percentile. Above each of these predictions is the true number of deaths and the true number of confirmed cases by a surveillance system called the COVID tracker. So example, on March 16th, there was 97 deaths and 6,000 cases at that time. And below this plot is just some of the social media news going on at the time to give you an idea of what was happening then. First thing to note is that experts predicted somewhere between 150 to 250,000 deaths by the end of 2020, which seems to be on track. These predictions did not change, right? This is almost 2 months, 2 month span in time, and they're fairly stable over time, given different news and media that's going on, different issues in the coronavirus cases, right? The predictions are fairly stable. That said, there is a broad level of uncertainty that experts had in this prediction. It's a very long range prediction over several months. You can see in the first survey, experts said anywhere between a little below 10,000 to maybe as many as 1 million, over 1 million. And even in the most recent survey on March 4th, still 100,000 to 1 million. So there was still a broad uncertainty, even though there was a stable point prediction. We asked the first 3 surveys, we asked this triplet question, the smallest, most likely, and largest number of deaths. In the last 2 surveys, we asked a percentile question. And you can see that that's somewhat changed the uncertainty. The uncertainty shrinked when we asked percentile questions. The smallest, largest, most likely seem to have broader uncertainty. So it may depend how you ask the question and how you want experts to answer. That may affect their predictions. Okay, well, why don't we talk about total infections? The question that I asked experts, for example, as of Monday, March 9th, what percentage of all COVID-19 infections in the US, either symptomatic or asymptomatic, do you believe are reported as confirmed cases in the table above? So I'm asking for the fraction that you believe were reported. Please indicate the smallest, most likely, and largest percentages below is 0 to 100. Here's the date the forecast was made. We asked this question 7 times. In the dark black or gray is the confirmed cases from a surveillance system. The green bars are the 10th and 90th percentile predictions from experts, and that green dot is the median prediction. This is the prediction of total SARS-CoV-2 infections, either symptomatic or asymptomatic, which we'll never truly know. I also included some computational models. In blue is the sentinel event estimate by Lover and McAndrew. In red is a stochastic simulation by Perkins et al. In yellow was this seed event model by Trevor Bedford. And in purple was a complementary approaches model by Liu et al. Just to give you a sense of what computational models were saying about the true number of SARS-CoV-2 infections in the US. First thing to notice, I think, is that overall, the consensus predictions by experts and the computational models tend to agree. They're not perfectly aligned, but they're in the ballpark. I think it's also important to say that these green predictions are above this black line most of the time. Experts expect or predict that only a small number of infections have been reported or detected. We can see that another way by asking not for the total US SARS-CoV-2 infections, but we can ask, what percentage do you think has been confirmed? What fraction of them has been confirmed? So on the vertical axis here, you have each of the different surveys where we asked experts this question. And then we have the probability they assign to each of the percentages or the fraction they think is confirmed. Overall, the median is somewhere between 15 and 16%. So experts believe that something like 15 to 16% of all SARS-CoV-2 infections were reported as confirmed. That median stays fairly stable over time. Okay, so we talked about the total deaths by the end of 2020. We talked about total infections that experts think may be circulating in the population. What about confirmed cases? Cases that were confirmed by a surveillance system. Here's an example of a question that we asked, as shown in the table in a figure above, and that was that figure of the plotted confirmed cases over time. The COVID tracker, which is a specific surveillance system, reported 751,000 total confirmed cases. What's the number of total confirmed cases in the US that COVID tracker will have in their daily report 1 week ahead, that coming Sunday, April 26th, for example? Here's the ask, or the way I want them to answer. We provided a set of ranges of possible confirmed cases, assign a probability to each bin corresponding to your belief of how many cases will be reported next Sunday. Each number must be between 0 and 1, so it's a probability. And all the numbers provided must sum up to 1. And I gave them a little total bar too, so they can see that they sum to 1. So here's an example where it could be less than 850,000, between 850 and 900, 900, 950, etc. And each expert would assign a probability to those intervals. Okay, what do we got? Well, we asked this question quite a bit. We asked it 13 different times. You can see in the top panel here is the date of the forecast. In the blue bars is the 5th and 95th percentile prediction from an expert consensus model. The blue dot is the median prediction. The black dot is the actual reported cases. So this is an example where we have kind of measurable outcomes, what actually was reported. The vertical axis is confirmed COVID-19 cases. And let's just look at this top panel for now. So this 90% prediction interval from the 5th to 95th percentile covers the true number of confirmed cases every time. So experts were able to at least get in the ballpark of the true reported cases 1 week ahead, each of the 13 times that they were asked. In this below panel, I still have the data forecast. On the vertical axis, I changed it to something called relative forecasting skill. The higher your forecasting skill is, the better you are, the more accurate you are at predicting something. The lower it is, the worse you are. 0 is equivalent to an unskilled forecaster, someone who's just saying, I don't know. In the blue dots are individual expert skills. The dark dot is the consensus forecast, so the combination of all individual experts, their predictive skill. The blue diamond is the median expert skill. And in yellow, I have, we didn't automatically start giving experts feedback. This was very much grassroots type of project with just myself and my postdoc advisor at the time. We started giving them feedback after a few surveys. I think something to note here is that over time, experts did seem to improve. Their forecasting skill does go up, at least the majority of individual experts increase, and the consensus does seem to increase, especially between March 22nd, March 29th, and then April 5th and 12th. I think something else important to note is that the consensus, this blue dot, is above this diamond most of the time. That is, the consensus is more accurate than a median individual expert prediction. So in some sense, combining all of their ideas together gives you a more accurate prediction than any individual expert on average. We also asked this question in 2 different ways. In blue, we asked for the smallest, most likely, and largest number of confirmed cases they believe will occur. And in red, we asked for those intervals that I showed you in the question. You know, assigned probabilities intervals, and they're very different, right, in terms of forecasting skill. So again, how you ask the question, how you ask people to answer impacts their accuracy, which I think is kind of neat. Quick recap. You know, experts gave fast, calibrated forecasts of the early COVID-19 outbreak to support decision-making directly. We did this early before computational models were online. So this is something that, you know, the CDC needed information. This was a way to give them information fast. In the future, which is, I guess, kind of now, you know, now that computational models have come online, we're shifting to a more complementary approach to support decision-making and forecast models. We're working with 2 great collaborators, one called Good Judgment and the other called Metaculus. These are 2 industry companies that are focused on human judgment prediction and improving that over time, how you do that. We also have another survey. So this survey was modeled, experts in modeling of infectious disease, and we asked them specifically about the outbreak and trajectory of COVID-19. We have another survey ongoing right now, asking a different expert group about vaccines and therapeutic solutions to SARS-CoV-2 and COVID-19. That one isn't every week, that one's every month. We ask questions and collect their results and then set up predictions that are open to the web. So you're welcome to go see those. I wanted to thank my previous postdoctoral lab at UMass Amherst, the School of Public Health and Health Sciences. My postdoc advisor in the top left, Nick Reich, who was really a great postdoctoral advisor, someone that I really admire and appreciate for all of his help. This is the team, the lab there in the Reich lab, and each and every one of them are a great friend of mine and really helpful. So thank you to all of them. I think it probably goes without saying, but I'm going to say it anyway. Thank you to all the experts. I consider each and every one of them, a good friend of mine and a foremost expert in the modeling of infectious disease. And without them, this research would not be, it wouldn't happen. So I think that I just want to say again, I can't say it enough, really, just thank you to all the experts that participated. Yeah, without you, it wouldn't be possible. So now, now I'm going to ask you, you're going to pose as an expert, and let me put this in the chat. I'm going to put this link in the chat, and we're going to, let me just share a different part of my screen here. And I'll drop this in the chat. Give me 1 minute. I'm going to ask you to, let's see, everybody in the meeting, to navigate to this link, if you would, which is a Google form. And what you'll see in that Google form are 3 different questions. I'm going to put them up here, and I'm going to share my screen so that you can see them. They're going to look something like this, and I encourage you to take a few minutes and put on your expert hat. So I'll give you everybody a couple minutes to answer those. I'm going to give everybody maybe just 1 more minute to decide if they want to participate and to send a few answers. Okay, looks like we got a good amount of responses coming in. All right, cool. While responses come in, I'm going to show you a little bit about this work and also something that students will learn in my class. I'm going to be teaching Population Health Data Science. I am currently teaching Population Health Data Science 1, and I plan to teach Population Health Data Science 2 and 3. And by the end of that 3-course sequence, I expect the students will be able to do something like this, right? They'll be able to combine statistical knowledge and thoughts and their hypotheses with something like an online response form, pull down the data with code. So I'm going to show you a little bit about that, just a few minutes, about what students will learn too at the end of my 3-course sequence, a little bit about what they'll learn. So if everybody can still see my screen, I'm going to show you some code and what's going to happen. What I did is I wrote Python code to pull from this Google form that you're entering automatically. There's some credentials and authorization stuff you need to go through, which is complicated and we don't need to do. But what it's going to do is take all the answers to your forms. It's going to retool them and kind of data munge a little bit to put them in a nice format, and it's going to plot the responses. So just to give you a little bit of a preview about what that looks like and what students might learn in my class. So here's some code. This is a Makefile, so students will learn about kind of data pipelines, and one way that they'll learn about data pipelines is this thing called Makefile. And you can see that in this Makefile, there's some code. I called it science. And 3 things will happen in this code. I'm going to import a sheet, which is this Google Forms sheet, and compute some data in a nice format. And I'm going to plot the first question. I'm going to plot the second question. And I'm going to write that the code is complete. And you'll see which students are currently learning Python right now. Here's some code to plot. It's only 58 lines to make this plot. And students are learning how to do this type of thing right now, begrudgingly or not, they're learning how to do it. So to run this, all I'm going to do is type make science. And right now this code is running. It's taking all your responses, it's pulling them down, and it's plotting them. And it's going to reply to me code complete when it's complete, if it works. Aha, it worked. So I'm going to look at your responses. So the first question we asked, the PA Department of Health, as of 2020-10/06, has reported 159,597 responses. There's more than 7 responses. See, something in the code didn't work. Let's try it again. Let's see. Oh yeah, look at this. I only got 7 responses. This is something else that I teach students, is that there's always going to be bugs. Well, we got some responses. Let me just see, maybe I can run it again. Let's see. We'll figure out what's going on. Only 7, that's interesting. Well, let's see what 7 of you said. How many confirmed cases of COVID-19 in Pennsylvania will the Department of Health report on the 11th, which is in a few days? Please select a single box that describes how many cases you think will be reported. The majority of people here, a little over 40%, think that 159 to 169,000 will be reported, which I think is probably very reasonable. Although 30% think 169 to 179,000, and a smaller proportion think bigger than that, 179 to 189 or 189,000 and more. Students learn in my class that you can represent this type of graph as a categorical distribution. So students will learn in Population Health Data Science 1, you can define a random variable that takes 1, 2, 3, 4 different categories and assign probabilities over top of them, and they're related to Bernoulli distributions, and they're related to the multinomial distribution. Students learn how to compute expectations for this distribution, and not just the visualization, not just showing this sort of data science visualization, but understanding the mathematics and statistics behind it and what makes it possible. This also brings up an interesting kind of point in research, is that people can make fair predictions based on information that they have just out in the world, right? Computational models depend on structured data, right? In very concrete data sets. Humans have access to unstructured data. You can rely on spreadsheets and such like that, but you also hear news, you hear things about what's going on from your friends and family and from other colleagues and researchers, and you can use that information that computational models don't have access to make predictions. The second question gets at that more. So this is the question was, the Centers for Disease Control and Prevention suggests wearing masks to reduce the spread of SARS-CoV-2, the virus that causes coronavirus, is important, but how effective are masks at stopping the spread depends on how many of us wear them. To what degree do you personally think those around you wear masks? where 10 is like everybody's always wearing a mask all the time, and 1 is I never see anybody wearing a mask. And here you can see that, which is probably correct, that, you know, it's somewhere in the middle, right? I see people wearing masks sometimes, not always. This is a sort of question that I think uniquely humans can answer. You know, it would be difficult to build a computational model and collect structured data on mask wearing, but we can get a sense of those who are wearing masks and if they're doing what they're supposed to, you know, by asking this question to humans. So this is something that really, you know, the first question computational models could answer, but I think a question like this, you know, do you see people wearing masks around you when you're walking outside? That's really a human question and a human answer only. Okay, let's look at some of your textual responses. We can also see all 26 here, right? It looks like, what was the highest one? Yeah, most people said 159 to 169,000. That's what I would expect too. Oh, and see, look at this distribution with everybody is an 8. That's good. That's really good. I wish it was a 10. See, then nobody said 10. Nobody said everybody's wearing masks, which I think is probably right too. Let's see some of these questions. Hi, Tom. You know, so the question was, what do you think are the most important factors that contribute to the spread of SARS-CoV-2 in the United States? This, again, I think is a human-only sort of thing. Humans are good at identifying important covariates and factors that might contribute to something. And so it looks like Trump's leadership, stupidity in politics, maybe, non-compliance with masks and quarantine recommendations, that's probably a good one. Ability to social distance and your exposure to other people without masks might be a contributing factor. So humans can give textual information, right? And give you context to these predictions and give you things to explore that maybe you didn't think about. So in a typical report to the CDC, I would include a distribution of predictions for the next week ahead that computational models can answer. So maybe the CDC would compare what humans have said are experts to computational models. I would give them this distribution, which is really a human-only sort of question, to give them a sense of compliance for non-pharmaceutical intervention, which in this case is wearing masks. And I would also give them a sort of collation or some summary of this question about important factors, which again is really, I think, a uniquely human sort of thing to do, is find factors and contributing variables to, in this case, the spread of SARS-CoV-2 in the US. So a report would look roughly like this with some text in and around it and summarizing information for them. And thanks for all the 26 people that participated in the forum. And the answers, I think they're really neat and they showcase what humans can do. So I'm going to stop sharing my screen and I'm going to take all sorts of questions if you have any. And you're welcome to put them in the chat and I can answer, and if not, that's okay too. Or you can you know, ask them verbally. So somebody asked, how do you think conspiracy theories are contributing to the spread of COVID-19? Yeah, you know, I don't know. I think that there is kind of 2 outbreak or epidemics kind of occurring. One is the COVID-19 pandemic. And I think another one is certainly the spread of information and misinformation. I think that it contributes to people's behavior, probably their adherence to non-pharmaceutical interventions and wearing masks. And I think that could contribute to the spread of SARS-CoV-2. A lot of my work in my PhD looked at it didn't look at infectious diseases, but it looked at the infectivity of social contagion. And so there's a ton of great work from the University of Vermont, from Chris Danforth and Peter Dodds, who were my PhD advisors, about how how information spreads through a social network. And I totally encourage you to go check out some of their work too, and you might get an answer there. Let's see, Laura asked, are you continuing the research with the experts right now? Yeah, so this project finished in May, and then I started another one on vaccines and therapeutics. So it's a different expert pool, but I'm asking similar sorts of questions and creating reports for the CDC about when they think a vaccine will be available, what its efficacy will be, if it is efficacious, how many people will take it, and doing a very similar thing here. We're aggregating probabilistic predictions from experts and sending it to the CDC, and it's also open to the public. So I can actually give you the link to that if you're interested in looking at those reports. Let me find you the link. It's actually a GitHub link from the Comp Uncertainty Lab called Vax Therapeutics Crowd. So I'm just going to drop this in the link or in the chat here. And that links you to 3 summary reports that we've built so far, asking experts. Okay, Marcia asked, what are the prereqs needed to take a class like this? Stats, comp sci, right, etc. For population health data science 1, prereqs are, calculus is not a prerequisite. I teach the class going in, assuming that you have, that you know algebra. And that's kind of it. We start with Python programming from the start, the basics, what's a variable, what's a list, what are the kind of basic structures and foundation for Python computing. And for statistics, I start from the very, very beginning, the foundations of probability, foundations of data. What is data? What's a variable? What's numerical information? How is that stored? So PhDS1 is absolutely from the very, very beginning, and then we just build on that for PhDS2 and 3, or at least I plan to. Yeah, you don't need a stats or comp sci prereq. Okay, Ramon asked, have you looked at information that allows you to tease out people who are less concerned about the virus, less likely to support mandates, etc.? I haven't looked at specifically people's behavior in terms of how that impacts the virus, the spread of the virus, but I think that it's a very interesting question, and it's something that I think not just experts, but really a crowd, asking a crowd of people in a certain county. I think that's something that any person could help tease out. So this is a case where maybe not aggregating expert predictions, but crowdsourcing and asking everybody, what are your feelings about people's impact on adherence to non-pharmaceutical interventions and the spread of disease? Okay, John asked, what kind of statistical model did you use for prediction? What are the key predictors that you found? Yeah, so the statistical model I use is super easy. It's a weighted average of each of the experts' predictions, their predictive distributions. So this is kind of a classic ensemble. We investigated whether or not certain factors, like their accuracy in previous surveys, impacts accuracy in the future, and experts are all over the place. If they had done really well or they were very accurate in previous surveys, there's no guarantee that they're accurate in future surveys. And so we investigated, weighting experts differently based on, how uncertain they are about answering questions, their previous accuracy in the past or performance in the past. And we found that an equally weighted ensemble or an equally weighted average of their predictive distributions performed not appreciably worse than a performance weighted ensemble. And if you want to investigate those statistical models that were used, I do have a preprint out that I'll put in the chat that I plan to submit once I get midterm grades in, and I'll put that right in the chat for you to investigate some of the details about the model I used and how we did performance weighting. It's in the supplement there. Chris Daly, this is really great work! Exclamation point, exclamation point. So proud of, hey, really appreciate it, Chris. I think it's really great work too. It's something that this type of work is a bit new to me. I spent 2 years before that studying seasonal influenza and building adaptive ensembles of strictly computational models, but I've always had in the back of my mind that humans are, can give you valuable input and access to information that computational models don't have. And so, so it's a new area for me and I'm really excited about it. I think that people can do good things. Okay. How do you handle selection bias is a question. Yeah, we don't. For this first study, you could even argue that the selection of experts was in some sense a convenience sample, right? So the way I selected experts was tapping into a group called the Midas group, modeling an infectious disease agents study or seminar, I think. And yeah, so you could even argue that the experts that I picked at first were a convenience sample, after which we open it up to a bigger crowd. But the people that are contributing probably have unmeasurable confounders and reasons why they were contributing. The questions that we chose each week, it was between me, my postdoctoral advisor at the time, and then also 2 or 3 members from Good Judgment Inc. and from Metaculus, which are these 2 kind of professional industry forecasting platforms. So in terms of selecting the questions, I went through some rounds of revision, but for sure, I think that there's biases in how we chose experts to answer these questions and the questions that we chose to ask. Well, I don't know. I don't see too many more questions, so I think I think I'm just going to say you can email me absolutely anytime. My email address is mcandrew@lehigh.edu. Please feel free to email me any questions you have about this work or the work on vaccines and therapeutics, or building ensembles of seasonal influenza, if that's still of interest to anybody. That's certainly a passion project of mine. And yeah, I really appreciate it and thank you.